Okay, so, alright guys, if you've hit this video, then you have hit the holy grail of how to cure your tennis elbow. I'm not talking about treat, I'm talking about cure. Now, the reason I'm making this video is because I have cured tennis elbow in my elbows twice. Once on my right arm 2 years ago, and I just got over a case of it right now. I'm actually back in the gym, and I'm 100%. And my tennis elbows were really, really bad. So I couldn't even have the ability to turn my arm over, close my hand really with even any sort of grip in my strength in my grip. Now the reason I want to share this video to you is because I've done a lot of research, and I cured it myself, and I don't feel it's fair for me to harness this kind of information. And I want everybody out there, you know, to get better, because I know how annoying this is. I know how debilitating it is and depressing it is for you to stay out of the gym or off the tennis court, or you know, it affects your work. So what we're going to do here is we're going to give you a day-by-day breakdown, full treatment plan on how you can get your tennis elbow better. I'm not trying to sell you anything. There's going to be no websites. I'm not going to ask for a credit card number. I'm just an honest guy who wants to share a way for you to get better the way I got better. And I actually helped my mother. She had tennis elbow, and now she's 100% cured. So let's get started. Before we go into a day-by-day treatment plan, what I want to do is kind of go over some of the materials you might want to grab. Some of them are necessary, some of them are not necessary. Just kind of gauge what you think you should buy and what you think you should buy. Now, the first thing I'm going to show you really quick are a couple of supplements. Here we have a triple flex right here, and it's just a joint formula. That's all it is. Some MSM, chondroitin, and glucosamine. It's in the correct proportions for you, and this will start working probably about 3 weeks from now. You can buy this, but it's not necessary. It always helps. And similarly, the fish oils here, these probably work. You know, take 4 to 6 a day, depending on your size, and these usually start to tend to work within 3 weeks. It's supposed to increase collagen production in your musculoskeletal system, making your tendons and more flexible and more resistant to injury. Now something else I was going to wanting to show you guys is also a TheraBand Flex Bar, which is right here. Now, I highly recommend these here. I mean, there's no such thing as a miracle to curing your arm. It's just going to take patience and dedication. But I think these aid a lot in the cure of your tennis elbow. Now, here we have the blue one. Here we have the green one. The blue one is considered hard strength. The green one's considered medium strength. And they have an easy and an extra easy. You can buy these anywhere on Amazon online. The big one's $20 max. This one's like $13, $14. Probably the best investment you could buy for your tennis elbow. I'm going to show you how to use these over here. The next thing you're going to want to use is probably something you already have at home, which is just a basic broom. Okay, I'm going to teach you how to use these here. These are all going to be done. All the stuff's going to be used so I can show you how to use eccentric exercises in order for you to strengthen your arm and realign the fibers of the tendon. And last but most certainly not least is, where did it go? This tennis elbow strap right here. It's just an elbow strap. It's worn. It's worn right about here. I'll show you exactly how to put it on as we continue day-by-day treatment of your elbow pain, and we're going to get you 100% back in the gym. But before I start, I just want to let you know that you're going to need to be patient. You're going to need to accept the fact that you're going to be out of the gym for a while, not too long, or maybe off the tennis court, or you know, whatever it is you enjoy doing that's making your arm worse and you just stop for a while. I'm going to teach you exactly how to stop, when to get back in, and how we're going to get your arm 100%, how we're going to get you back to your activity or job. Now, let's go. Let's start with week one. Week one. Let's go with days 1 through 3. Days 1 through 3, what you need to do is fully rest. There's a saying: price, protect, rest, ice, compress, and elevate. We're going to be doing all this on days 1 through 3. Also, we're going to be taking anti-inflammatory medications like Aleve, ibuprofen, whatever. I don't want you to take these medications past 3 days. When your arm swells up, it's an inflammatory response. Blood is being rushed to the injured area by your body saying, I am injured, and I need to get blood flow there in order for it to heal. So you want to take it easy on these anti-inflammatories and icing. And so days 1 through 3, ice, ibuprofens, Aleve, whatever it is, and complete rest. Don't do dishes. Don't do laundry. Don't go to work. I just need 1 week for you to take off work or whatever it is, and you do find a way to take 1 week off it. Just complete rest. So days 4 through 7 is going to be very similar. You're just going to rest. Don't do dishes. Don't do laundry. Don't do anything. Don't scratch your back. Just kind of have it hanging. And this by the end of day 7, your arm should be starting to feel a little bit better. But that's just because the swelling has gone down. Now we're going to move on to week 2, and during week 2 we're going to start to use this elbow brace right here. The elbow brace, you could use it to kind of start to get back to your regular work, or I don't suggest you play tennis. You got to stay off tennis. You got to stay out of the gym. Actually, I got mine from weightlifting, the gym, or whatever activity it is that you do. You need to stay away from it for the time being. Now let me teach you how this is worn. This here is worn. What you want to do is find the crease on your arm and measure 2 finger lengths below, and then right about there, you're going to want to tighten it. You want to get it nice and snug, but not to the point where it's extremely uncomfortable. Now this here will act as an artificial joint, and it helps relieve, your hand or wrist motions from going, straining your tendon, lateral epicondyle tendon. So we're going to be doing that week 2, okay? And you start to kind of go back to work. Now, by this point, for some people, the injury is going to start to feel a lot better at this point. For a lot of people, but even if it does, they still want you to continue with the treatment for the mere fact that we need to also prevent it from happening. Okay? Now, week 3, we're going to continue to wear this, at the job or whatever it is, washing dishes, whatever it is you need to do. Don't forget, we're staying out of the gym, we're staying off the tennis court, we're staying away from the activity that aggravates the injury. So week 3 is we're going to start to do some basic stretching. You're going to hold your hand out with your elbow lock directly in front of you, and just pull your fingers down gently. And hold for about 15 seconds, and release. And do it again for about 15 seconds, and release. Now you're going to want to point your hand down, and point the face of your wrist outwards, and push down gently for about 10 to 15 seconds. And you're going to want to do 3 sets of that each way, about 3 times a day. So you're going to do that completely on week 3. So by now, your arm should start to feel a little bit better.